Hey there, everyone. It's Paul again with New Jersey Recovery and Wellness. Thank you so much for hanging out with us as we continue to commemorate National Recovery Month. Each and every single day, we're talking about different ways to support a person in your life who you know and love who has a substance use disorder or is in early recovery. Thank you for checking out day 12 of our 30-part series. 12. Seek your own support. Everyone can use a helping hand from time to time. If you have a substance use disorder or a mental health condition, you certainly qualify here. You also qualify if you have a family member or a loved one who has a substance use disorder or a mental health condition. This still holds true. Today, we're going to talk about the benefits of reaching out to others. How do you support a person in your life who has a substance use disorder? Seek out your own support. Now, this support can come in many forms. We've already talked about going to a self-help group earlier in this series. In addition to this, which is still a very strong suggestion, you can also consider some of the following. First off, talk to a friend. Our friends are the people that we choose to be in our lives. These are the tribe that we accumulate over the years of our relationships with other people. Ideally, friends that we've chosen to include in our lives are non-judgmental. They're able to hear us out. We're able to confide in one another. We're able to support each other. Unfortunately, during the course of having a person in our lives who has a substance use disorder, and the shame and stigma that can be attached to that, we can find ourselves stepping back from some of these relationships. Stepping back can be physical in the sense of we spend less time with them, we're not able to catch up or connect so often. Over the course of time, when our loved one may be actively engaged in their substance use disorder, if we find ourselves having our own set of behaviors to try to manage or mitigate any damage that that individual may be causing in our lives or the lives of other people, we often spend less time tending to our own needs. Sometimes that means that we step away from our meaningful relationships, our other meaningful relationships. Friends can be the first ones to go. In other cases, you may not have less time spent with these individuals that you've chosen to have in your lives. However, you may notice that you're not really talking about the meaningful, hurtful experiences that you're having in your life connected with the person who has a substance use disorder. You're not talking about your pain. You're not talking about the struggles that you've been having. So even though you still may be spending physical time with friends, being able to confide in them, entrust in them, be vulnerable with them, maybe that's how to change. In addition to talking with friends, you can also find ways to connect with other people who are in the lives of the person who has a substance use disorder, other people who are supports to the person that you're concerned about. More often than not, one of the things that propels addiction moving forward is secrecy. Family members, loved ones, people who care for the individual that has a substance use disorder, unfortunately, don't connect and don't collaborate together on how to support the person with the substance use disorder. Sometimes this is intentional and it might be referred to as splitting, and sometimes this is unintentional. This is our own individual reactions to our concerns. We step back. It's difficult to talk about uncomfortable things. We may be responding to shame. And so not just us, but also other people in the lives of the person that we're concerned with. If we're all concerned and not talking about the concern, we're all, in essence, struggling alone, even though we have a common struggle. The idea here is to open up, to get comfortable with the uncomfortable, to get vulnerable with another person, and talk about your shared concerns for the person who has a substance use disorder. So talking with friends, talking with other loved ones, as well as going to a self-help meeting are all very, very real and very, very valid suggestions for seeking support. You can also seek support professionally. You can go and see a therapist. Seeking therapy can happen in several different ways. There's individual counseling, there's couples therapy, and there's family therapy. There's no right or wrong way. However, your particular needs and what you're looking to accomplish may lend towards seeking out one part of counseling as opposed to another. If you're considering seeking support through individual counseling, keep in mind, this is going to be a place for you to get open and dig deep emotionally. Some people go to therapy to vent about what's going on. And in the process of talking about their lives and talking about their concerns, we're able to learn our own lens, our own thought process about what's going on. A seasoned counselor, someone who is well versed in working with individuals or families that have a person with a substance use disorder, they can help you understand a little bit more of the process of what's happening for your loved one, as well as understanding and having compassion for what you're going through as well. Through these conversations, you can talk about several different considerations for little shifts that you can make, something that's going to be helpful for you. This is another way to consider self-care. If you've been thinking about couples counseling, the idea that you may be looking to approach is the relationship that has been impacted between you and your loved one with a substance use disorder. More often than not, this is of a marital relationship or for a couple has been together for quite a long period of time. In couples counseling, you do need to understand that there is no one identified patient. The couple is viewed as the patient. The therapist, hopefully who's seasoned in addressing couples as well as addressing substance use disorders, is going to help you navigate and understand the different components of your relationship. And then from time to time, take a look at the role that alcohol or other substances play in that relationship. So sometimes it doesn't just take two to tango. When we have a person in our lives who has a substance use disorder, there ends up being a third. Going to couples counseling is going to help you understand the nature of what's happening here, identify and work through the major points of conflict, and work towards healthier, balanced communication, lending to more trust and fulfillment. When you're looking to consider family counseling, this is the acknowledgement that everybody in the home has been impacted by the substance use. So depending on the dynamics of your own personal family situation, there may be many people that end up going into this therapy space. So we may have an individual with a substance use disorder who is a parent, is going with their spouse as well as their children, or maybe the person with the substance use disorder is a child, could be an adult child, and the substance use has impacted relationships with siblings, with parents, potentially grandparents, and other family members or other people living in the home. Family counseling is a rather complex process, and it's really, really important that everyone who is involved be agreeable to participate in family counseling. A small highlight that I just wanted to emphasize here when it comes to family counseling. Children are an underrepresented population when it comes to seeking therapy when they have a person in their lives who has a substance use disorder. Unresolved conflicts that a child experiences when they're trying to mentally grasp what's going on, if these items are not resolved and not talked about openly in a supportive and caring environment, there's potential for this child to take away maladaptive life lessons and carry them moving forward in lives. This is why in an earlier segment in this series, we talked about addiction being referred to as a family disease. It's very, very critical, very, very important that we're talking about this openly with our family. If these conversations are difficult, that's okay. That's what family therapy is for. Seeking support has the potential of offering so many things by means of self-care and connection with others. And at the same time, we need to acknowledge what seeking support does not do. Seeking support does not make your loved one better. Seeking support, seeking your own support, is for you, not for your loved one. Directly. We'll get to my meaning there in a moment. If you're seeking your own support by talking to a friend, talking to another loved one, or seeking your own therapy, this is really a means of self-care for you. Think about the expression of when you are in an airplane and the air cabin pressure destabilizes, the oxygen mask drops from the ceiling. What do? You are instructed to secure your mask to your face before helping out anyone in your party with theirs. Seeking your own support is securing your mask. We want to make sure that you are well, that you are getting the care that you need so that you can be there emotionally and physically ready for your loved one when they are in need. Seeking support for yourself is not going to make them better. It's going to better equip you to be there for your loved one. Seeking support is not a way to leverage your loved one into treatment or therapy of their own. Although coercion may have its place, and that can sometimes be a very, very controversial topic, especially when talking about having your loved one seek their own therapy for a substance use disorder, this isn't really what we're going for here when we're talking about your own support, your own help. This is not designed to try to force the person to get their own. Sometimes a person may take the approach of, I'm going to my own meetings, you need to go to yours. I'm going to my own therapy, you need to go to yours. This is not a way to try to arm wrestle a person into something that we want them to do. If you find yourself approaching it from this angle, this is definitely something to talk about with a professional. Also, seeking support does not automatically fix problems in your relationship. Seeking support is a way for you to take care of yourself. And if you're seeking support with someone who has experience with this, such as a friend or another loved one, or if you're seeking support through a self-help meeting or seeking support through a professional, they may be able to provide some other suggestions, some ways that have worked for them. Helpfully identifying other skills that are going to be more effective in having open, productive communication about your concerns with your loved one that has a substance use disorder. It's not going to fix things. It's going to give you ideas and opportunities on how to put in the work to get to a better place. And just to recap, now that we've identified some of the things that seeking your own support will not do, we do want to also just overemphasize here. What it does offer is a place to process what's going on in your life, your interactions with your loved ones, and becoming more aware of your own thoughts, emotions, and reactions, and better equip you to do your part in making changes in the relationship. When we start making our own shifts and making them consistently, our loved ones have more opportunity to start to make theirs. They also have more hope that these shifts will be successful. How do you support a person in your life who has a substance use disorder? Seek your own support. Thank you again for checking out Day 12 of National Recovery Month. If you liked what you saw, hit that like and subscribe and ring that bell so you can get more notifications of other parts in this series coming up, as well as other videos that we just put up on our channel. Again, thank you so much for hanging out with us. Hope to catch you next time.